I'm honored to appear before you today to present the Department of Health and Human Services fiscal year 2026 budget.
I want to move to that. I want my questions answered on, are you freezing and withholding funding that Congress appropriated in 2025 for life-saving NIH research?
You have the power of the purse here.
Thank you.
You know that.
Thank you for reiterating that, but I think that I'm not sure the administration really has internalized that, particularly Mr. Vogt hasn't internalized that when he says that we can in fact, impound money. The money is there. The 2024 budget includes the funding for the NIH. Will you commit to spending the money that is in 2024 in that budget?
As I've said, Ranking Member, if you appropriate the money, I'm going to spend that money.
The money has been appropriated, so the answer to that is if you're not willing to accept the funds that have been lawfully voted by members of the House and Senate on the money for the National Institutes of Health. Well, I'm going to hold you to your word that that funding is there. It should be transferred from 24 to 25, and you've cut already $20 billion. Let's get that money back.
Agree with a lot of the things you've said. Some of the things I question, want to see more studies on.
Who made those decisions, you or Musk?
They were made, ultimately, we executed the decisions.
I know you executed them, but my question is,
Elon Musk gave us help in figuring out where there was waste, fraud, and abuse in the department. But it was up to me to make the decision. And there are many instances where I pushed back and said, we don't want to, that would hurt us to eliminate that group.
let me ask you a question based upon that response. Was there an analysis of the consequences of these cuts and the reduction in force and elimination of programs?
The analysis that we're spending $2 trillion a year that we don't have.
Mr. Musk said he was going to cut $2 trillion.
$2 trillion more than you have to make cuts. The other analysis that was more detailed is that
children or the Indians that you're so concerned about?
We didn't cut the Indians. We didn't cut the Indian
that.
services.
I'm asking you, you said we have to cut.
I made sure that those services were not cut.
How many employees have been let go so far from your?
About 10,000 left, took the fork in the road, about 10,000 more.
And how many are on administrative leave now, waiting to be fired in June?
Well, that would be the second 10,000.
Okay, so and are they currently being paid?
Yes.
Yeah, so they're being paid to do nothing.
Well, there's a lot of them are supposed to be coming in still.
But they're coming in to do nothing because they're not allowed to work.
Oh, no, we want them working.
Are you empowered to reverse these decisions?
Yes.
You are, okay. And
if you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I have directed Jay Bhattacharya.
Sure. No, like I said, I don't want to.
So that everybody can make that decision. But I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Right. No, I got that. And I'm not asking you to give them medical advice, but would you vaccinate your child for measles?
If I answer that question directly, that it will seem like I'm giving advice to other people, and I don't want to be doing that. I want people to make.
But that's kind of your jurisdiction because CDC does give advice, right? I'm not trying to do it as a gotcha. I was just kind of.
What?
If you are successful in banning fluoride, I noticed you congratulated Utah and Florida, I think, for banning it. That's up to them. They can do what they want. But we better put a lot more money into dental education because we're going to need a whole lot more dentists.
And showed a direct inverse correlation between fluoride exposure, dose-related, and lower IQ. It's an issue that we have to all be concerned with. We want high IQ kids.
Mr. Hoyer,
right now.
Mr. Hoyer.
I appreciate that, and I look forward to working with you on it.
Okay.
Good news in West Virginia. I want to thank you and your